The definition of interstitial cystitis is a sense of bladder pressure or pain and the need to urinate frequently. So the cause of painful bladder syndrome in males is not quite known. It's thought that there's a break in the lining of the bladder called the epithelium. This results in a leak of harmful materials from urine, and that this causes the bladder lining to become irritated and painful. Risk factors for painful bladder syndrome include recurrent urinary tract infections, irritable bowel syndrome, age over 30, and chronic pain conditions, which include things like fibromyalgia. So with regard to interstitial cystitis, it's always recommended to see a urologist first for appropriate workup. You want to rule out infection. Often a cystoscopy is done. Cystoscopy actually involves insertion of a tube with a camera at the end through the urethra into the bladder. And this actually looks at the bladder wall and the urethral lining. With interstitial cystitis, the cystoscopy will actually pick up what are called Hunner's lesions, which are essentially ulcers in the lining of the bladder wall. Whereas with painful bladder syndrome, you will not see the ulcers. So treatment is actually includes multiple modalities like physical therapy to address pelvic floor hypertonia, injections to actually address pelvic floor muscle spasm, as well as nerve irritation, medications like antidepressants, which are actually given to decrease pain, antihistamine medications to decrease irritation and pain, and even medications like Elmeron, which is thought to line the wall of the bladder and actually prevent leakage and irritation. We also include things like bladder installations, which is the insertion of a medical fluid into the bladder to help actually calm down the irritation. And in some cases, we would consider surgery. Surgical procedures can include things like expanding the bladder, as well as removing the ulcers from the bladder wall. For more information on pelvic pain conditions, you can reach our website at pelvicrehabilitation.com.